Well, it's a catheter which is introduced into the renal artery, and then 3 needles come out of the catheter, go through the vessel wall into the adventitia, and then we inject a small amount of alcohol. It's only 0.6 cc, and that distributes around the vessel and destroys the nerves. So this is another technique to do renal denervation beside radiofrequency and ultrasound. Well, this was a trial non-randomized. We just kind of a post-market registry, and we looked in 45 patients, how it's working. And everything was controlled, very, very good design of the trials. We had a clinical event committee and core labs for all parameters. And we could show that there's a blood pressure reduction after 6 months of about 18 millimeters of mercury. And when you look at 24-hour blood pressure measurement, there was also a blood pressure reduction of about 10 millimeters of mercury. So it seems to be very effective. The problem is that it is significant, it is clinically relevant. So we know when we reduce blood pressure by 10 to 20 millimeters of mercury, that has a huge impact on the mortality and morbidity of these patients. But still, it's an invasive procedure, so patients, referring doctors, payers may hesitate to refer patients to this procedure because they may believe that this effect is not enough for an invasive procedure. So this is something where we have to educate all those who are involved in this. We had so many positive trials with renal denervation. I mean, there had been randomized trials, there had been control trials, registries, and all showed the same. There was just one single trial which was negative. All other trials have been positive. So I think it was kind of misconception that this single trial, which was negative HTN-3, was just put onto a high bar. That was not representative of what we know from clinical experience, also from animal testing. Before we started this in humans, we did animal testing. So it works everywhere, just in one single trial. The whole renal denervation bubble just collapsed because of one single trial, which was HTN-3. About renal denervation, I think this will have a bright future, but it needs more time, and definitely it will change. I'm very much convinced it will change the way how we treat patients with hypertension.